Giselle, a lot was covered during the 2025 legislative session for the state, including budget, energy, and education legislation. What bill stood out to you?
Well, really, any bill that passes that impacts client systems that are served by social workers will impact social work practice. However, there are three bills of particular interest. The School of Social Work is especially committed to tracking and supporting legislation that improves social work practice directly. And three of those bills that passed this session that will have a significant impact: the Interstate Social Work Licensure Compact, the Preserve Telehealth Access Act of 2025, and Health Occupations Structural Racism Training Requirement.
Why are these bills significant to the social work practice?
Well, these three bills specifically are significant to social work practice because they're really responding to some dramatic changes that we have seen in behavioral health in general, especially during these last 5 years. For example, we've seen an increase in need for behavioral health services along all populations, and telehealth care has significantly grown since the beginning of the COVID-19 pandemic. And telehealth is here and will remain an integral part of behavioral health services.
Do these bills change how we educate and prepare future social workers?
Well, when you think about the primary goal of any graduate program, is to really prepare students for professional practice. And so at the School of Social Work, we teach ethical, evidence-based approaches that strengthen individuals and families, agencies, and communities at the local, national, and global levels. So this education really develops the knowledge, the values, the skills necessary to practice. And this includes keeping current on policy changes as well as advancing policy changes to address any gaps and improve conditions impacting individuals and communities.
Now that the bills have passed and session is over, what are your thoughts on the next steps in the future of social work?
Well, really, that question is best answered by explaining a bill that did not pass this past session, which was Senate Bill 379 and House Bill 1521, the State Board of Social Work Examiners Membership and Examination. And that bill, which did not pass, proposed the removal of the requirement to pass a licensing test for entry-level social work licensure, either the licensed Bachelor of Social Work or the licensed Master of Social Work license. And this bill was important because it was in response to the National Association of Social Work Boards' release of national data in 2022 that revealed troubling disparities in exam pass rates among racial groups, particularly for Black test takers. Other groups, including older adults and those for whom English is not their primary language, also face lower pass rates. These disparities were found across the state and the country and highlighted systemic inequities in the exam. And so even though this bill did not pass during this session, the School of Social Work is committed to continued advocacy efforts at the state and national level to address these concerns.
What is the Social Work Licensure Interstate Compact and why is it important?
Well, any interstate compact is a legal contract between states, territories that enable professionals to practice across state lines in each other's jurisdiction. And it gives members of that profession more license mobility. With the passage of Senate Bill 174, House Bill 345, Maryland is now the 25th state to join the National Social Work Licensure Interstate Compact. And in the future, social workers will be eligible to apply for inclusion into a compact with other participating states.
How does the Social Work Licensure Interstate Compact help Maryland social workers specifically?
Well, currently, social workers must seek a separate license in every state or territory in which they wish to practice. Each jurisdiction has their own licensing requirements for continuing education, their own renewal fees, which are often complicated and expensive. So an interstate compact will expand the employment opportunities for social workers who continue to reside in Maryland and are able to provide services to individuals residing in multiple states or territories. And so the Social Work Interstate Compact also provides flexibility and support for spouses of relocating active duty military personnel.
And who else benefits from this compact?
Well, those individuals receiving services from social workers will benefit from the flexibility offered by an interstate compact. These include an increase in access of care for individuals in need of social work services, especially in areas that are underserved, geographically isolated, or lack specialty care. Social Work Interstate Compact will also enhance interstate teletherapy services. In addition, the Interstate Compact will improve continuity of care when clients are traveling or relocate. Currently, a client must be located in Maryland to receive services if the social worker is licensed in Maryland. So an easy example is a student that is attending a college out of state is unable to continue their behavioral health services with their social worker who is licensed in Maryland. And so this change, when the Interstate Compact is operationalized, will allow for this continuity of service.
What does the Preserve Telehealth Act do, and what does it mean for social workers?
Well, this is extremely significant, not just for social workers, but really for any healthcare professional providing telehealth services. So with the passing of the Preserve Telehealth Access Act of 2025, the state laws related to the coverage and reimbursement of healthcare services delivered through telehealth will be permanent. And without this significant change in the law, they were set to expire on June 30th, 2025. And so while this bill addresses all health care services delivered through telehealth, it will benefit social work practice because it includes social work telehealth services. This legislation to preserve telehealth in Maryland is critical because it ensures continued access to health care services, particularly for vulnerable populations. There are lots of benefits of telehealth services that we learned, especially during the onset of the COVID-19 pandemic. But some of these benefits include equitable access to care, expanded behavioral health support, crisis intervention, flexibility for families and caregivers, and keeping telehealth in place ensures that Maryland remains prepared for any future public health crisis.
Why is telehealth especially important in social work?
Well, social workers are often cited as the largest group of behavioral health service providers, and the popularity and availability of telehealth services has extended our reach and the availability of behavioral health services provided by social workers.
What's new about the training requirement for social workers with this structural racism training requirement bill?
Well, many social workers and healthcare practitioners will remember in 2021 that a law required all licensed health professionals, including social workers, to complete a training in implicit bias approved by the Office of Minority Health and Health Disparities. And so House Bill 783 amended that 2021 law by adding a new structural racism training requirement for all health professionals in addition to the implicit bias training requirement that was established in 2021.
What does structural racism mean in this context?
Well, Maryland law will now define structural racism. That definition can be located in Health General Article Title 20, 1301F, and it describes structural racism as the totality of ways in which societies foster racial discrimination by mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice.
Why is structural racism training important for the profession?
Well, the National Association of Social Workers guides the profession through a National Social Work Code of Ethics. And in this Code of Ethics, it defines social justice and service and dignity and worth of each person. And the social work community is deeply committed to these values, and this training requirement will support those efforts. And the training requirement to complete structural racism training is very much aligned with our current social work licensing requirements, because in Maryland, the continuing education regulations were changed in 2023 for social workers, and they added a requirement for social workers each license renewal to complete 3 continuing education units on the topic of anti-oppressive social work practice.
And how often are social workers required to take this training?
So under House Bill 783, this new requirement for structural racism training will be a requirement for all health practitioners, including social workers, and it will be required once in a professional's career. So these training opportunities will be approved by the Cultural and Linguistic Healthcare Professional Competency Program, the same program that approves the implicit bias training opportunities. And so to further clarify, they say that an applicant will attest to the completion of an implicit bias and structural racism training program only on the applicant's first license or renewal after April 1st, 2026.